Here on The Colour of Country Life, we're speaking with South Australian Health Minister Stephen Wade. Thanks for joining us, Stephen.
Yeah, good morning. Thanks for the opportunity, Ricky.
Now, we've had some policy promises from the Labor Party. I might actually start more broadly just about Labor saying they're going to take $100 million of what the state government's promised of this $662 million entertainment situation in Adelaide CBD, and they're just going to put it into country health. What is the state government promising in dollar terms in terms of allocation of spending in regional SA for health purposes?
Well, we're continuing to make new health announcements in the campaign. Yesterday I was at Port Pirie announcing a major redevelopment there, $26.1 million to provide a new emergency department, medical imaging and a short-stay crisis mental health facility. I think it's really important that people remember that this is the Labor Party that spent on average less than $4 million a year on country health infrastructure in its last term of government. The Marshall Liberal government has spent 5 times that much each of the years that we've been in government, and we've committed to almost $200 million of investment, and that's before the announcements such as the one I made yesterday. So people in rural and regional South Australia know that the only party that delivers a sustained commitment to rural and regional health is the Liberal Party. Recently, we came to an agreement with GP representatives to invest $188 million in rural GP services in country hospitals. That's a significant improvement in the remuneration of GPs from the past agreements. That's an important part of making sure that we have not only the health infrastructure, but also the medical teams to run them.
One of the elements of that infrastructure is the Keith and District Community Hospital, which I know in opposition, the Liberal Party had a lot to say about. Labor's promised, I think, a 7-year funding of around $9 million for that hospital. We know that then it's not going to be a full emergency 24-hour system in Keith, but what is the government committing to do over the next 4 years for Keith Hospital?
First of all, we've had in place a sustainable funding agreement with Keith Hospital, but literally as we speak, there is a consultation underway with the Keith community in relation to a new healthcare hub at Keith. My understanding is that there's been a lot of interest in the proposal, and we're looking forward to the community feedback. We need to make sure that the health services in all of our regional communities evolve as the needs of the community evolve.
Well, the member for Narunga was a Liberal. He's currently independent. Fraser Ellis has had a bit to say about the Ardrossan Hospital, claiming their funding runs out at the end of the financial year. He said there was that announcement you mentioned at Port Pirie, but nothing locked in post 30 June for Ardrossan Hospital. What's the government's position on that? Yeah,
we haven't made any forward estimate commitments to Ardrossan Hospital, but we continue to work with all of our health partners right across the state, both for-profit and not-for-profit hospitals. In terms of the provision of medical services, we have been purchasing a significant level of services from the community and private hospital network. And we'll continue to do so going forward.
Well, that's Keith is an example of that, isn't it? It was largely a private hospital, but you've got a hybrid kind of public-private model for that one going forward.
Yes, well, certainly there's the proposal that's out for consultation involves both state government money and community resources.
So with the Kingston District Hospital, I think they closed down briefly due to concerns of its proximity to aged care during the COVID pandemic. Is there money on the table for the Kingston District Hospital for forward planning?
My understanding is that Kingston wasn't closed so much for the proximity of aged care. I think it was more in relation to that they actually had an outbreak within the facility. But my understanding is that's now been resolved and it's now operating normally.
But there's, in terms of future funding for Kingston District Hospital, are there any promises or commitments there in terms of dollars for them in the next 4 years? Not
that I'm aware of. In terms of certainly there've been no campaign policy commitments, but in terms of the forward capital program, the Marshall Liberal government has committed to a $150 million country capital works sustainment program going forward. And we've been in our first 4 years, we delivered above and beyond the commitment there.
Now, I'm whizzing around the hospitals here. The last one I'm just coming to mind is the Waikerie Hospital. There was concerns about obstetric services, I guess, in the last year or so, and local member Tim Whetstone spoke with us recently about that. What's the plan for the Waikerie Hospital? Are we going to see an expansion of services at Waikerie?
My understanding is that the main problem in relation to Waikerie and the midwifery service was the recruitment of staff, and the latest update I had was that they were continuing to have problems to fill the vacancies there. One of the ways that the Marshall government has tried to make birthing services more sustainable in the country is rolling out what we call the midwifery caseload model. This is where you have a number of different midwives in different towns working together to support one another to provide a midwifery service on a regional basis. We're continuing to roll out our rural health workforce strategy, which includes strategies to recruit and retain midwives. We know that right across rural and regional South Australia, there are rural health workforce shortages, not only in relation to GPs, but including nursing, midwifery, ambulance officers, and allied health. A lot of those programs are having a positive benefit. There's been a significant number of increase in the number of medical students training in country South Australia during the term of the Marshall government.
Now, that's the hospitals that exist. The one that doesn't exist yet is a Barossa Hospital that's been long promised by the Liberal Party in the seat of Schubert. Have you bought some land for this hospital now, or where is the planning at for a Barossa Hospital?
Well, the Marshall government is steadily delivering on its commitment to build a new Barossa Hospital. For the first time, there is money in the state budget, $6 million, and that will cover both the identification and purchase of land and also planning work. We are close to confirming the site on which the new Barossa Hospital will be built. We started with 16 possible sites, but the shortlist has been narrowed down to 2. This is obviously a critical decision, and it's involving a lot of work on the ground. We've got to make sure that the land is appropriate in size, that it's close to transport infrastructure and has the capacity for medical retrieval via helicopter. Also, just recently, we've appointed expert clinical service planning consultants, John Staff. John Staff will support the development of a clinical services plan for the hospital, which then feeds on and informs the design requirements. All of this will involve consultation with clinicians and the community to make sure that we get the best possible hospital for the Barossa community. Certainly the local Liberal candidate, Ashton Hearn, has impressed upon me the importance of this hospital for the Valley. She's fighting hard for this project, and I'm sure she'll make sure that it stays on track. Is
there a sort of zeroing in terms of which town it might actually be in, or is that still up in the air with those 2 final shortlist sites?
Yeah, I'm not in a position to flag the sites. The basic requirements for the site are that they had to be central Barossa locations. They need to be a single greenfield site. We think about 5 hectares of land. And we need to make sure that it's flat land to give people with disability or mobility issues ease of access to the site. It needs to be close to the highway and also have capacity for the medical retrieval via helicopter.
Are we talking about something with accident and emergency 24-hour facilities, or would it be more focused at preventative and other healthcare?
No, this is very much an A&E. Hospital. It'll be providing the range of existing services, but also the building will enable new service types, new models of care, and more patient-centred services. Importantly, it will be able to avoid increasing infrastructure sustainment costs. It'll be able to meet higher safety and quality standards. And reduce pressure on the Gawler Health Service as well. So this is a really exciting project for the Valley, really exciting project for the region.
Now, just more broadly, those that aren't closer to hospitals, they've had to rely on the Patient Assistance Transport Scheme. The state government's increased the per kilometre rate, and I imagine the accommodation rate recently, but hasn't changed for decades.
Yeah, well, the fuel subsidy for PAT scheme hasn't increased for 20 years, didn't increase once during the 16 years of Labor. It's been doubled, so it's from 16 cents per kilometre to 32 cents a kilometre. It's the latest of a range of enhancements that were made to PATS right through the 4 years of the Marshall Liberal government. In that regard, I think one of the ones that was one of the changes that was most warmly welcomed by country South Australians was the removal of the requirement that the trip needed to be for medical purposes only. The guidelines now allow a person to undergo other non-medical tasks while they're also doing the PATS trip without losing their fuel subsidy or their accommodation bonus.
Now, I understand the IT system surrounding that had to be updated, and that's been going on for some time, but that was a reason given previously for why it's not indexed, why it just doesn't follow, say, the average petrol price or something like that. Is there scope for it to be indexed in future?
Yeah, I'm not aware of any state that has automatic indexation, and with schemes such as this, I think it's important to sort of try and get the balance right. We do provide support indirectly as well. So, for example, the Marshall Liberal government committed $10 million towards the new cancer accommodation facility on Green Hill Road. That will mean that facility be more contemporary, better suited to the needs of modern patients. There'll be facilities for support of patients as well as their accommodation while they're in Adelaide.
All right, well, we've only got about a week or so ago to the state election. We'll keep an eye out for further announcements. Stephen Wade, Health Minister, thank you very much for rolling through the hospitals there and policy issues for country South Australians.
Great. Thanks, Rick.